Hello everyone, this is Dr. Ray Strand and welcome to this evening's webinar, Why You Can't Lose Weight. I have been asked this question so many times in my 40 years of medical practice. I have a patient that comes in and they say, Dr. Strand, I've never had a weight problem and I'm 32 years old and I haven't changed my eating or my exercise activity level for the last 15 years. And last year, I put on 15 pounds. This year, I'm already up 22 pounds. What's going on? And they will tell me other times that, gee, I've tried this diet. I've tried that diet. Why this diet doesn't work or what's going on? And so it's a very, very frustrating thing. When people try different diets, they try different programs, they try to cut down the amount of calories they're eating, they try to increase their exercise, but they just can't lose weight. So tonight's webinar, we're going to go into the different reasons why people either can't lose weight, or if they lose weight, they'll quickly put it back on, or they just lose weight so slowly. So this will give you some ideas of what is maybe happening as far as you are concerned. And so the first thing that I look for in my patients is, do they have underlying insulin resistance, or what I refer to as prediabetes or the metabolic syndrome? Because the hallmark sign of having underlying insulin resistance is the ability to lose weight effectively. In other words, people that have underlying insulin resistance hold on to fat like a sponge holds on to water. Well, there's a reason this occurs, because of our poor lifestyles, and I've talked about this in previous webinars, but because of our poor lifestyle, usually involving the all-American diet and the inactivity, over the time, over years, we just become less and less sensitive to our own insulin. And our body responds to that situation by actually making more insulin. And so I want to show you how this looks. I had a pharmaceutical rep who brought in this chart, and I think this shows very, very clearly what we can find in as far as this is concerned. But let me just share with you, people come in, and this graph here is 25 years a time frame. So you could even go back here another 10 years, because poor lifestyles, just usually the all-American diet, you're spiking your blood sugars, you're stimulating the release of insulin, and then that leads to uncontrollable hunger, and usually crave another high glycemic meal, and you just do this over and over again. So it's kind of like hollering wolf. You just are abusing your insulin over and over, year after year, and eventually your body just becomes less sensitive to your own insulin, and you tip over into what we call insulin resistance. So as insulin resistance gets worse, the body compensates by making more insulin. So blood insulin levels begin to rise. As long as these two lines parallel, your blood sugars will remain normal. Now, what happens though, you have just now tipped over into an abnormal metabolic state where a calorie is no longer a calorie. In other words, you can't utilize calories normally for several reasons, but the main reason is that the muscle, which normally takes up 85 to 90% of all your calories for any meal or snack and utilizes them as energy, can no longer take in those calories like it used to. So now many of those calories are being diverted to the fat cells of the abdomen. And their insulin's job is to convert that glucose to fat and then block the release of that fat. And so this is really a critical time. So what people begin to notice in this area is that even though you haven't changed your activity level or your diet, you start gaining this unusual amount of weight around your middle. I really become concerned when women's waist size gets over 32 inches and men's waist size gets over 36 inches. But there are other things that begin to happen. Your blood pressure begins to go up. Your triglycerides, that other fat in the blood besides cholesterol, goes up. That good HDL cholesterol goes down. And you find that over time, the total cholesterol goes up. So you go in this state for 10, 15 years, but the old body just can't keep making that much insulin. So what happens is eventually insulin production starts to drop. And then whoops, there goes your blood sugar up. And it's in this area where we start to diagnose as physicians diabetes. So the day you actually come into my office and I diagnose you as being diabetic, it really is after 15 years of accelerated aging of your arteries. And the hallmark sign, though, is weight gain around your middle, or what we call central obesity. And this is what people get frustrated with. Well, you have to remember, insulin is your storage hormone. That's what it is. So when you have high insulin blood levels, you just can't lose weight. And so if I were to look at my patients as they come in, I would say the reason 85 to 90% of my patients who come in that are overweight, it's because they have underlying insulin resistance. So what you'll hear me teach and talk about, and what I learned and started back in the 1990s with my Healthy for Life program, was to really go ahead and develop lifestyles. In other words, if it's poor lifestyles back here that gets us into this problem, maybe healthy lifestyles will get us out. And so I spent 3.5 years studying the medical literature, looking for those lifestyles that actually improved insulin sensitivity. And there was a triad that I learned. First was eating a healthy diet that did not spike your blood sugar, and that improved insulin sensitivity. The second is just modest exercise, aerobic activity. And for example, just simply walking 30 minutes five times a week significantly improved insulin sensitivity, but also nutritional supplementation in what I refer to cellular nutrition, which is provided in RX's Optimals, where you get your minerals and antioxidants. There's the minerals at these optimal levels like chromium, vanadium, magnesium, selenium, improve insulin sensitivity from a different mechanism. Then you find that antioxidants like vitamin C, vitamin E, and all the antioxidants improve antioxidants from a different mechanism. But what I was able to do when my patients would literally actually improve insulin sensitivity so much, they would literally tip back into a normal metabolic state. And then their blood insulin levels would drop. In fact, I have now done 3 clinical trials using my online Healthy for Life program, where people we tested them through what we call IRBs, Institutional Review Board, which is under the guidelines and direction of the FDA, and we found their blood insulin levels dropped within 12 weeks of doing these 3 healthy lifestyles. They dropped 50%. They literally are able to drop back into this level. So not only did their blood pressure come down, their triglycerides come down, their blood sugar improve, and their cholesterol and triglycerides improve, but they started to lose weight. They began releasing fat, just as mysteriously as it came on. But what I learned is unless you are able to reverse this insulin resistance, they just aren't able to lose weight or lose weight effectively. And that's why you'll hear people say, well, jeepers, when I was young, when I was 23, 24, I have a few pounds, man, I could go on a diet and lose weight very quickly. And when I was 27, 28, it was a little harder. And then when I was 32, I just couldn't get rid of it, or when I was 40. Well, the reason is they were getting down here, further and further down the line of insulin resistance. So we know insulin resistance leads to diabetes. And so what I teach in my medical practice, when I'm looking at people who are overweight, yes, I'm concerned about their weight, but their weight is the result of insulin resistance. And I can actually now project who's going to become diabetic 10 to 15 years down the road just by looking at an expanding waist size, triglycerides going up, their good HDL cholesterol going down, before their blood sugars even go up. And I really encourage them to firmly establish healthy lifestyles that improve insulin sensitivity. So this is the main reason people cannot lose weight. And so this is something that you want to look at and realize. So anyway, what we want to do now is look at another reason people can't lose weight, and this is called hypothyroidism, or underactive thyroid. Now, your thyroid gland controls your metabolic rate. It puts out thyroid hormone. And there are many, many individuals out there who have hypothyroidism but do not realize it. And so if you have had a recent weight problem where you're putting on weight or you're gaining weight, what you'll find is that people need to go out and have a blood test. Now, I generally run a blood test called TSH, or thyroid stimulating hormone. Now, that is a messenger sent out from the brain, and what it is that if the brain senses that the body or the thyroid gland's not making enough thyroid, then this thyroid stimulating hormone will go up. And so when that goes up, that means you do not have enough thyroid on board. Now, the normal for a TSH used to be a high of 5.5. But what they found is that there are many people who still had underactive thyroid that were not being diagnosed, so they just recently dropped that to 4.5. But in my medical practice, I find that there are several people who actually have subclinical hypothyroidism. Now, in other words, these are people who have gone into their doctor, they've had their thyroid function checked, it all comes back normal, and they're told they don't have thyroid disease. But we now know that there is a significant number of people who still have underactive thyroid, but their thyroid hormones are normal. So you should be concerned if you have symptoms where you feel cold all the time. In other words, you've got sweaters when everybody else is in short sleeves, or it's the middle of summer and you need a jacket. Another hallmark sign is constipation. Your body slows down when you have this. In other words, you just have infrequent bowel movements. You may have fatigue. People with subclinical hypothyroidism or hypothyroidism have fatigue. But another key thing is weight gain. And so putting on weight and not being able to lose that weight, one of the things I've always got to check is patient's thyroid function. And so you can do a TSH, T3, T4. You can get the free T3, T4. But one thing I tell my patients is if I do all the checkups and they have these symptoms and yet I find no evidence in the blood work that they have thyroid problems, then what happens is I go ahead and I actually go ahead and have them take oral temperatures. Now, these are not basal temps. In other words, they're not the first temperature when you wake up in the morning. I like my patients to be up at least 3 hours. And to get a good thermometer, take oral temps, and what you want to do is not have anything hot or cold to eat or drink 10 minutes before 10 to 15 minutes before you take your temperature. Now, what we are looking for is a consistently low temperature. Now, in my ladies, of course, after we've got to we have to be, you know, aware of where they are in their menstrual cycle, because after you ovulate, your temperatures will rise about a degree. So I usually, in my ladies, have them take their oral temperatures off and on for about a month, and I just have them record it. But if all your temperatures are low, let's say 96 or very, very, very low 97s, then I become concerned that you have subclinical hypothyroidism. Now, in my medical practice, I will go ahead and give these people a trial of thyroid hormone. And I have to say, I prefer Armour Thyroid. And that's something that I don't like as far as that is concerned. But so basically, I will give them a 90-day trial on Armour Thyroid. And that's something that I work with. But if they get a good response, it is a great response. And it is not a problem. That's something that you just see happening. And if they don't get much of a response, then most likely they don't have a problem. So let's look at other issues that cause unusual weight gain and inability to lose weight. I think one of the most common reasons as my women develop weight problems is because of hormone replacement therapy, especially synthetic hormone replacement like Premarin. It is just well known that anybody who starts estrogen hormone replacement, one of the side effects is weight gain. Now, you will not hear this when you talk to your doctor or your doctor tries to prescribe hormone replacement. Now, this is usually for women in their menopausal years. Many of these women may not have ever had weight problems at all, and then they start hormone replacement and they just put on an unusual amount of weight. Well, estrogen is known not only that you retain fluid and will put on sometimes 6 to 8 pounds of fluid, and a lot of women who actually have been on birth control pills will notice this fluid retention. But hormone replacement therapy, estrogens, then synthetic hormones, will actually put weight on. And if you don't believe me, we live in ranch country, and my wife and I love to go out and help people brand their cattle and work their cattle. It's just something we enjoy doing. It's really interesting to see these ranchers tag their calves' ears once they've been branded, and you look at the tag and it's estrogen, and you talk to the rancher, why do you put estrogen? You know, these ear tags, they absorb estrogen. Well, that's because their calves will gain an extra 1 to 2 pounds per day if they put those estrogen tags in their ear. So when I see my women who've never had any problem with weight problem get into menopause and they end up on hormone replacement, I personally don't use synthetic hormone replacement. I use natural or bioidentical hormone replacement if I have to, and I only use it short term because I'm trying to get them through this menopausal time where they're having either mood swings or they're having hot flashes or all of this going on, because there is evidence, strong evidence now, coming out from research that no one should really be on long-term hormone replacement therapy. It used to be thought that hormone replacement therapy decreased your risk of heart disease and of Alzheimer's dementia and of breast cancer and all of these things. And so doctors liberally just prescribe synthetic hormones if you are in menopausal age. Well, now we realize that just the opposite is true, that you start synthetic hormone replacement, you increase your risk of having a heart attack or a stroke. You actually increase your risk of breast and ovarian cancer. You do not decrease your risk of Alzheimer's dementia. And yet doctors still want to use hormone replacement therapy. And so this is something that I would discourage you to do. But you know, the other thing is that you might understand that a lot of women, because they're afraid of estrogen, will just take progesterone alone, because some of that progesterone becomes estrogen in the body, or they'll actually go and get a natural progesterone like yams from their health food store. But I have had women who have been on natural progesterone put on a tremendous amount of weight. And even with natural bioidentical hormones, it is still a problem. And I just find that, yes, some of my patients need hormone replacement therapy, but others, if you can get by without it, I prefer my patients not take it. Or if I have to use it for a year or two, I'm always working to try to get them off. In fact, I use some bioidentical hormone drops that allows my patients to vary the amount that they're using. And this is critical. So that is key, but it's something to remember. And I'm just going to throw in here too, and I forgot to really mention it. I have a lot of my ladies. I did obstetrics for 21 years as a family physician. And I always checked my patients that were pregnant for gestational diabetes. And not many had their blood sugars go up, but I had so many patients who would gain a tremendous amount of weight, even though they didn't have gestational diabetes, during their pregnancy. Well, those people were really tipping over into this metabolic syndrome or insulin resistance and putting on this unusual amount of weight, but the blood sugars weren't going up. And then they would deliver usually a larger baby, and then they would get pregnant again. They didn't lose the weight they had before, and they put on all of that amount of weight. And it's important because hormones are so critical in weight loss. So I always try, to use, I try not to use any hormone replacement therapy. If I do, I go to bioidentical hormones, and I'm always trying to get my patients off. Sometimes you just can't. But it is, if you are trying to lose weight and you're taking hormone replacement therapy, it is just going to take you longer to lose weight. You can still lose weight. You can be effective, especially with RX weight management system, and I'll get into that here in just a minute. But you just have to understand it's a little bit slower process. Now, a lot of patients do not realize that some medications that they take actually cause weight gain. Some of the most common are what we call NSAIDs, or non-steroidal anti-inflammatory drugs, like Motrin or Aleve. These, not only do you put on fluid retention, but you can actually gain weight with them if you're on them for arthritis or things like that. But I think the primary drug that causes weight gain are SSRI antidepressant medication like Prozac, Zoloft, Paxil, Effexor. There are so many patients now that are taking SSRI antidepressants. Now, I just have to share some stories. I've been in practice a long time, and when Prozac first came out, I remember the pharmaceutical company and their reps coming into me and telling me, oh, Prozac is wonderful. Not only does it help depression, but people will lose weight on Prozac. That's how they presented it. And then all of a sudden you didn't hear anything about it. And several years later they came out with once-a-week Prozac, so you didn't have to take it daily. And I remember asking the pharmaceutical rep, why did you come out with once-a-week Prozac? And they said, well, jeepers, we don't get as much weight gain with once-a-week Prozac as we did our daily Prozac. And I said, well, I didn't know you had weight gain with Prozac. He says, oh yeah, people gain tremendous amount of weight. Well, that's when I really started to look at these drugs. SSRI medications actually set off an uncontrollable hunger and set off carbohydrate cravings and addiction. And it's been very well documented in my practice and in the medical literature. I've had patients on Paxil who within a year put on 60 to 80 pounds. So if you are on an SSRI antidepressant and you're either gaining weight or you're trying to diet, you can't get it off. This is tough. Now, I work with my patients now And what I try to tell them, probably the best SSRI as far as not causing weight gain is Effexor. That's the lowest one on this list. However, they all do it. Now, if you can get off your SSRI antidepressant, many doctors don't like that, you will find that you're going to have much better success losing weight. But another antidepressant that doesn't fit in this SRI category is Wellbutrin. It's a little harder to take. It has more side effects, but it does not have the weight gain problems that the SSRI drugs have. In some of my patients, I'm able to switch over. But if you can't get off your SSRI, and I'm not telling people to just stop them, you've got to work with your doctor. But at least take the least amount necessary and realize it's just going to take you a little longer time to lose weight. So what I like is to just make people aware of the fact there are other factors that you have to take into consideration. You know, as far as, do you have underlying insulin resistance? Do you have underactive thyroid? Are you taking hormone replacement therapy? Are you on any of these drugs that can cause weight gain? Because it will affect your ability to lose weight. But I want to tell you, I am very excited about RX's weight management system. And I just want to, I've had a webinar, I'm going to have more on this. We're going to be really getting into details. But just as an overview, I want to share with you why this is a unique program and there's nothing else like it in the marketplace today. First of all, we have SlenderX and Accelerate. Now, SlenderX is a combination of many different homeopathic drugs. Yes, they're drugs. FDA considers them homeopathic drugs. Now, they're not hormonal. There is no HCG hormone or anything like that. These are a combination that have been put together uniquely, have been studied for the last 2 years and in clinical trials, and have been found to be very effective because some of the homeopathic drugs actually accelerate that release of fat from the fat cells. Remember, I told you that when you're in insulin resistance, you hold on to fat like a sponge holds on to water. Well, this SlenderX helps start releasing that. But also, there are homeopathic drugs there that suppress appetite. And it's very important to understand that it helps lower your natural appetite, and there are other homeopathic drugs that improve or accelerate metabolism. So it's a wonderful combination, and it is great. But SlenderX does not work that well unless you actually have a low glycemic diet or a diet that does not spike your blood sugar, and you keep it at 1,250 calories or less. Because as you eat what we call a lower caloric diet, now it's nothing like the HCG diet where you can only have 500 calories and you can't exercise, but 1,250 calories is a good amount, but it's still less than you've probably been eating. But when you do this, then your body is going to start to use fat stores, and SlenderX accelerates that fat release, so it actually improves this. Now, I like and I encourage my patients to use Pure Nourish, and the reason is not only is it low glycemic, it's GMO-free, but it's soy, dairy, and gluten-free. And the other thing is you put 2 scoops, you mix it with almond milk or water or maybe coconut milk, and then you put in some fruit. You still only have a meal. It's 230 at the max, 250 calories. And so if you have 2 Pure Nourish meal replacements a day, then that allows you to have 2 regular low glycemic snacks and 1 low glycemic meal. And I teach this on my website so you understand all of this. And it's very, very easy. But when you start to eat this way, after the first Pure Nourish or after eating your first low glycemic meal, the medical literature shows us insulin levels begin to drop. In other words, blood insulin levels come down. After your second meal, insulin levels drop even further. And so over time, you're improving insulin sensitivity. You're on SlenderX. It's working better, and so you're going to begin releasing fat. Well, the other reason I like RX's weight management system is that they encourage you to exercise. You want to be doing some aerobic activity, for example, just walking briskly, 30 minutes, 5 times a week. Significantly improves insulin sensitivity, drops insulin levels even more, allows you to release more fat. It's not so much calories in, calories out, as it is that you are releasing fat easier and insulin levels begin dropping. Now, it doesn't really matter what you do, just so you get the body moving. Whether it's biking, swimming, hiking, tennis, racquetball, it doesn't matter. Just get the body moving. But then I really encourage all my people on SlenderX to take at least the optimals, the vitamins and minerals, which provide the cellular nutrition. And again, the reason is that in the optimals, you have the optimal levels of chromium, of vanadium, magnesium, selenium, which have all been shown in separate clinical trials to improve insulin sensitivity. And then I, of course, like omega Q, which, the fish oil decreases inflammation. It actually lowers your cholesterol, triglycerides, and it has the very potent antioxidant CoQ10 there. And of course, the optimals also have the antioxidants, vitamin E, vitamin C. In fact, it has over 20 different antioxidants. Most of those in clinical trials have been shown to also improve insulin sensitivity. So when you combine all of these, there's a synergistic effect. When you use SlenderX and Accelerate, you are not going to have great success unless you're on a 1,250 calorie diet and that diet is low glycemic. But what you don't understand is not only does SlenderX decrease your appetite, but when you begin eating a low glycemic diet, you quickly get out of these carbohydrate cravings and addiction because of the hormonal effects that occur when you spike your blood sugar with a high glycemic meal. So your natural appetite comes down. In fact, after a week or two on RX's weight management system, you actually have trouble eating 1,250 calories. You're just not that hungry. So one of the problems we have is getting people to eat. I don't care. We don't want you to quit eating. You want to eat 1,250 calories because you do better. And this is what we're trying to do, because what we have learned is that lifestyles are critical. In other words, weight loss, yeah, it's great, but it's really not the problem. It's keeping it off. So keeping your weight off is priceless. And that is what we are trying to encourage you at RX. Now, I just would encourage all of you to consider going to my website at healthconceptsint.com, and if RX members and customers to go to /RX, because I give significant discounts to my 12-week basic Healthy for Life program. It's a 90-day program that is now at healthconceptsint.com. The normal cost is $29.95, but in that program, you are going to get a nutritional course, because I have my video trainings where I go over all of this information. Every time you log on, you're going to get health tips on how to protect your environment, how to eat out, how to eat when you travel, all of these things. And you get great resources into knowing what is low glycemic food. I've actually categorized over 1,500 different foods into low, medium, and high. Low glycemic, moderate glycemic index, and high glycemic index. In fact, I actually look at glycemic load, the amount of calories in these foods, and the quality of foods, so I can guide you. And we have a search engine. You can look up any food. But the key thing is you also get your own lifestyle journal, where you record how you're eating, how you're drinking, how you're exercising, how you're taking your supplements, and this is automatically graded. I've learned over the years with my patients that the hardest thing to do is to help people make these lifestyle changes and firmly establish them in their life. So this website is really uh, a, a, a behavioral modification program. But RX members go to healthconceptsint.com/RX and you can get that program for $19.95. So it's a great savings. It's insignificant cost when it comes to the support. And I have my video trainings on there, and I have all these resources. So anyway, I feel that people come in, we're going to get people even on the RX weight management system, and they're going to wonder, why aren't I losing weight as fast as this person or that one, or maybe I'm not losing it as much or that. And we take you by the hand and teach you these healthy lifestyles. So I just believe that it's the synergy, it's doing it, because in the end, everybody who finishes my 90-day program either becomes a lifetime customer or your best representative. So this is there to help you. It's a total package, and you'll be learning more and more about this as you deal with RX's optimals and how we are doing. So I have to say I'm very excited that you could join tonight, and this webinar has been recorded. If you're listening and you say, gee, I wish so-and-so could hear this webinar or that, it'll be posted here sometime in the next week, and it'll be available 24/7. So I want to thank you for joining this webinar. I will be having another webinar in 2 weeks, and it's going to be dealing more with my online medical practice, and I'm going to talk about autoimmune diseases and my approach. I've had such wonderful results using nutritional supplementation in patients who have an autoimmune disease like lupus or rheumatoid arthritis, MS, Crohn's disease, ulcerative colitis, scleroderma, all of these different autoimmune diseases. And so come and join me then, and we'll just have a wonderful time learning how you can better protect or possibly even regain your health by an aggressive weight loss program.